Taking chronic medication for blood pressure, diabetes, cholesterol, heart disease, having stent and bypass surgery are becoming increasingly common among us. Is it a lack of medicine or stent or bypass surgery that is the cause for high blood pressure, diabetes, cholesterol, and heart disease? We all know the answer is no. It is very important for us to understand what this means. We should wonder why we seem condemned to take medicines for these diseases for the rest of our life. We should consider why medicines and surgical procedures do not provide a cure. We know medicines add to the stress of our kidney and liver, but kidney and liver patients take multiple medicines without a stop. What is the science behind this? Is not change essential in this current treatment approach? Have you ever thought about this? How can diagnostic examinations predict the chances of a heart attack? If examinations show the possibility of heart attacks, what next? What are the risks associated with medication, angiography, angioplasty, bypass surgery, etc.? For those who have already suffered a heart attack, do stent and bypass reduce the chance of future heart attacks? If such interventions and operations are avoided, is there an increased risk of death from heart attack? How is it possible to optimize lifestyle to reduce blocks, repair damaged blood vessels, promote natural bypass by collateral vessels, and improve cardiovascular health? How is it possible to reduce and stop medications for lifestyle diseases? What can a heart attack victim do to avoid a repeat heart attack? Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind this health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with their benefits and limitations. Also, I'll try to convey the fundamental relationship of this health condition with the lifestyle and the impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who would prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medications with the added effort on their part. It should be remembered that those who are on medication should reduce or stop medicines only under medical supervision. Heart is pumping blood to all the organs, and at the same time heart also need to have blood. So for supplying the cardiac muscles, the cardiac pump and the muscles which is acting for this pumping, the heart has two arteries, one right coronary artery and the left coronary artery. And the left coronary artery has two branches, one is anterior and second is the left circumflex artery. So this right and left coronary arteries supply the cardiac muscles actually. These arteries are actually passing it is passing in the outer part of the heart and then piercing inside. Inside is the blood, no? So it is the arteries are outside. You might have seen the pictures of the heart. So this arteries also is covered with fat also. If a cardiac patient, when the really heart attack or bypass patient, the whole heart will be covered with the fat, and these arteries are covered with fat. Next, when we know about the heart functioning, next is how this, if the muscle is there, then how it is pumping is happening. Next, we should know how this muscles is acting. And for the muscles to act, there should be some message, some nervous system to be connected with the muscles. For that, actually, the heart has its own cardiac system, actually, that there is own brain that is called pacemaker, actually. So that is a sinoatrial node, that is it is called, actually. And from the sinoatrial node, the node which is sitting at the pulmonary artery area, the top of the right heart, right atrium, actually. 4 chambers are there. Heart is a muscular organ. It has 4 chambers and 2 atria and 2 ventricles. Atria is actually collecting, right atria is collecting all the blood coming from the systemic circulation from our hand, leg, brain, and all is come first into the, through the vena cava, comes into the right heart. And from the right heart, it comes to the right ventricle, right atrium, right ventricle, and pumped into the lungs. And from lungs, it comes back to left atria, then comes down to left ventricle, and then it is pumped to the aorta and given all the body. For this happening, this to happen in a systematic way, there is a pacemaker that is actually the source of from the electrical impulses start from the pacemaker, that is the sinoatrial node. Then it comes to the atrioventricular node, and then to the right and left bundle branch. That's all nerves, actually. These nerves inside this heart system is kept in an insulated way, that is called, that insulation is called cardiac skeleton, actually. It is made of special collagen, actually. It's a type of protein. And if there is any problem with this collagen, the patient may get a irregular, many of us have heard about irregular heartbeats, palpitation. Those things are occurring because of this, there is damage to this cardiac skeleton or this nervous system inside the heart. And also it is connected to the brain, especially the brain stem. Brain stem is controlling all this involuntary activities, mainly through the vagus nerve. The vagus nerve, it's a nerve which is, it's an autonomic nervous system is controlling. So heart has its own control, and it is this cardiac nerves inside this pacemaker, and is connected, controlled by the central nervous system, mainly from the brain stem. Direct input is there. Then when we come to the physiological aspect of the heart, it's basically it is pumping to the blood, and if there is any problem, any part of the body is not getting enough blood, they will send messages. Every cell has a capacity to communicate with the other part of the body. So if a part, for example, if your leg is not getting enough blood, the leg will send special messages, so the heart will be starting pumping in a stronger way. Then more blood is trying to push the blood. That is why the reason when it happens, the blood pressure increases. If the kidney is not getting enough blood, kidney will send certain hormones, renin-angioplastin mechanism and all is there. So it will increase the blood pressure, and heart will beat stronger and try to push more blood into the organs. Then another chemical aspect or biochemical aspect also is there for this pumping. These electrical impulses from the brain to the heart, vagus nerve and to the heart, and also the internal pacemaker and the cardiac nerves inside this bundle branch and all these things, it's all work is a sodium potassium pump. So the sodium potassium, the two electrolytes, we all check the electrolyte in the blood level and all, no? So this electrolyte sodium and this potassium is actually the basis of this electrical transmission itself inside our system. Then the muscle activity. The muscle activities depends on actually calcium. Calcium, actually, that is why the calcium level also to be maintained in the body in a correct proportion, or it should be maintained in the blood in the optimum levels. Then only the cardiac function and all the muscle functions can happen. And next is the hormones. These hormones are messengers circulating in the blood, and it is reduction or increase will come down, increase the heart rate, decrease the heart rate, all happens. They are all acting on the sodium, potassium, calcium channels, and there are so many hormones which is acting for the heart. From the brain there is hormones, from the kidney there is hormones. It is interacting with the liver and also to the lungs and also the heart itself. There is a natriuretic peptide is there from the heart. So many hormones are interacting. That is why the heart function is going in a systematic way, or according to our demand of the body. This is become faster or slower. And if there is a problem with the plumbing, that is the circulation, that is the blood vessels, and we have our house is having a major system like plumbing is there for the water connectivity and the electrical connectivity. Those are the most important for each house. Just like that, the coronary arteries and the cardiac nerves are the very important for the heart also. That is plumbing and electrical system of the heart. Next is, what are the diseases affecting the heart? There are many diseases affecting the heart, but we will be concentrating on mainly which produce a heart attack actually. So we are mainly which needs stenting or bypass surgery and all. So what are the type of blocks? Actually, we have all heard that the coronary artery block, for which we are doing the stenting, angioplasty, angiogram, all those things we are doing for that. So it can be a gradual block. So if it is the block in the coronary artery is gradual, there will be symptoms will be tiredness, exercise intolerance. If you do more exercise, you will get tired, and also you can feel the pain also sometimes. Next is a sudden block. Actually, that is what is called a heart attack. In heart attack, one of the vessel supplying a part of the heart is blocked within few minutes or something like that. So the whole blood flow is obstructed, and the part of the muscle is not getting any oxygen, and then the pain can occur. The pain can be of different way. If it is which type of blood vessel, or if a big blood vessel is blocked, then the pain can be severe, and also the symptom will be different. And the patient can, if the major blood vessel is affected, the patient can become unconscious and can go into a cardiac arrest. Even heart may stop. That is what actually when the cardiac arrest happens, if at home and all, even if we are not able to give CPR or revive immediately, after if at all we revive the patient after 15 minutes or 30 minutes, the brain function might be lost, because the brain cannot survive without oxygen for more than 3 or 4 minutes. So if at all a cardiac arrest happen with an attack, then it has to be immediate revival will be needed. Otherwise, even if you may get into a brain death can occur. Then how can you differentiate between this heart attack, whether the pain can be the chest pain, or the pain can feel like in the jaws or the shoulder or the elbow, especially left elbow. If that pain, or it may be like a heartburn, like acidity, how can you differentiate whether it is a cardiac pain or acidity only? Or even the pancreatic problems can produce, liver problems can produce such sort of pain, or even muscle and joint pain. This rib joints can also produce pain. How can you differentiate between which part is actually is a heart attack or not? If you are already undergone a heart attack and all, you will be having some sorbitrate or nitroglycerin sort of tablets will be given to put under the tongue, sublingual tablets to keep under the tongue and get absorbed, and you will get a relief. If you are already had an attack, or if in the history of family history of heart attack, you should always keep a sorbitrate tablet. You should always keep a sublingual tablet with you, and you can put the tablet and see whether you are getting relief. And if you suspect an acidity, then you can take an acidity tablet or syrup is available. You should keep. If you are a heart patient, you should always keep such things with you. Then if you take the acidity medicine, if the pain is gone, you can take it as it's a gastrointestinal problem. Next is what is the reason for this block itself? See, the heart attack or the angina or the heart attack comes because of the block. And if it is an angina or it's only narrowing, actually in the angina there is narrowing only. That is why the reason why it is narrowed. The blood vessels are narrowed because there is fat deposits inside the lining of the internal lining of the blood vessels. There is fat deposit. So when the fat is deposited, the lumen of the coronary arteries become narrowed down, and the blood flow will be reduced. And some bumps or small projections also, which is actually small tumors. It will like some sort of lipoma tumor. It is happening inside. When it's a major part is blocked, or 80% or 90%, the flow will be reduced, and there can be stagnation of the blood and a clot can occur. Or this fat swellings ooze out, and some fat contents and all comes out. And then the platelets are there. That is, they are the cells which prevent bleeding or any oozing or anything happen. They are supposed to come and seal that area. If the atheroma or this fat deposits ooze out, this platelet will come and attach, and they will seal the area, and a clot formation take place, and it will completely block the blood vessel. So if it's a major blood vessel it is happening, we will get a major attack. And it can, if the major attack comes, it can even affect the nerve conduction. And if the nerve conduction is affected, you can get an arrhythmia or a cardiac arrest can happen. Next, if it is a small attack, a small blood vessel only is affected, and especially if you are diabetic, you may not even know there was an attack. Only after multiple small attack, you get a cardiomyopathy or heart failure. Then only when you check into detailed examination, you find out that there is previous attacks are there. So the extent of damage to the cardiac muscle and extent of damage to the nervous system, which decides what are the symptoms also. Then next is why this fat deposits is coming inside our coronary arteries, and also it is applicable to all the other arteries. If the atheroma or coronary fat deposition and block is coming in the coronary artery, there is other blood vessels in supplying the brain or supplying the legs, and also will be having the same problem. So it's a circulatory system. It will not be confined to one area alone. So what is actually making these blocks? So the predisposing factors mainly is, one is cholesterol and triglyceride, this dyslipidemia. Next is diabetic patients and the hypertension patients. See, even the hypertension is also happening because of this. Hypertension occurs mainly when before the hypertension, most of the patients will be having dyslipidemia. That is, cholesterol is high, triglyceride is high. So it is the triglyceride are high. Actually, the triglyceride is more damaging. Actually, that is excess fat inside the blood. The blood is the fat content in the blood is excess, and the fat cells in the body is not accepting the fat as a storage substance. So it will try to deposit anywhere which is available. So that is deposited in the blood vessels also. That is what is happening. And when the blood vessels are clogged, the heart has to, the flow is less. So the heart will, the cells will say, there is, the organ will say there is not enough blood we are getting. So the messengers will come, and the heart will try to pump more blood into a obstructed area, then the blood pressure will increase. So this will actually, this blood pressure increase and the fat deposit, and also when the diabetic patients, this glucose itself, it act as a toxin, and there will be mechanisms which are hyperinsulin, type 2 diabetes. Actually, the adult people gets most of these problems. No? So the adult onset diabetes, that is type 2 diabetes, the insulin level is also high, and insulin level actually trigger this sodium retention. When hypertension comes, we always advise to reduce the sodium intake. So actually, when the type 2 diabetes, there is insulin is high, it will increase the sodium retention, and also almost all the medicines, most of the medicines at least, and the insulin we are giving as a medicine for the diabetes also increase the sodium retention, and there is increasing the chance of hypertension. That is why most of the patients, some of the patients at least, first diabetes starts. When you start with the start medication for the diabetes, you get the hypertension also. Basically, the patient who is going for a heart attack or who is needing a angiogram and all, either diabetic or hypertensive or obese patients, and also the smokers. Smokers also having this blood vessels will be get damaged because of these toxins in the smoke, and they are constricted, and their blood pressure will increase. And it's all playing added factors. Actually, even the alcohol is also the chance of getting heart attack is high, and because this alcohol itself is a carbohydrate. So there is possibility for accumulation of fat inside, and the cholesterol and the triglyceride and all can increase. So they all add the chance for heart attack. Next, how can we find out what is the possibility of heart attack in you, or when you are having a pain or something like that, then how do you find out whether it is because of the heart attack or a cardiac problem? See, in such patients, if you are breathlessness or something, it can be because of atherosclerosis. And the first test usually, or say prefer, or a routine health checkup, we do a TMT, that is treadmill test. If the treadmill test positive, then there is a problem. And next you can check if you had a real chest pain, or otherwise also if you are suspecting, you can look into the troponin. Troponin, that is actually a muscle, some part of the cardiac muscle itself, which is oozed out when you had a heart attack, or there is a heart muscle damage is there, troponin comes out, you can measure that. And also the blood vessel inflammatory level, that is hsCRP, you can check. And also you can measure the thickness of the fat deposits inside the blood vessels. For that, actually, we are using the carotid arteries. The carotid arteries are the big arteries which is supplying the brain. That is very close under the skin at the neck. Carotid intima media thickness, that is actually can be measured with an ultrasound scan. Ultrasound scan is almost harmless actually. It doesn't have any side effects, so we can use it freely. CIMT is checked with the ultrasound scan, so it is doesn't have much of a side effect or anything. So we can check the CIMT test and see the thickness, and after lifestyle correction, you can repeat it also and see the changes coming also. Then is another test we can do with the ultrasound scan itself is a echocardiogram. That also gives the idea about the heart. Next test we can check is to see what is the extent of narrowing of the coronary arteries is CT angio and also MR angio. The problem with this CT angio and MR angio, it needs some injection in chemical into the blood to see the visualize the things, blood vessels and clearly. That can create problem, especially for the kidney. It can damage. And if you are going for a CT angio or MR angio, before that you should check the kidney function, because most of this patient who is suspecting will be diabetic or hypertensive or dyslipidemia is there. Those patients will be having deposits in the kidney, circulation also will be affected. If the GFR is low or the microalbuminuria is there, then you should be careful, try to avoid such a test also. Next is, that is all, you are suspecting, you are not in an acute stage. But if you are pain and you are in acute pain and you are suspecting a heart attack, then what will you do? In that case, ECG is the one of the thing which, that is ECG means that is the electrical activity of the heart is the measure looked as an ECG. It's a graphical representation of the electrical functioning inside the heart. In the ECG, there are two types of heart attacks according to the ECG finding, two types of heart attack. One is STEMI, that the ST segment elevation in myocardial infarction, and non-STEMI. There is no ST segment elevation. If the ECG shows that ST segment elevation, there is heart attack is there, then you have to be careful. And then if it is non-STEMI, then you can check is the troponin, or otherwise also. In acute stage, what we can check is a troponin test also. Troponin T is more sensitive for that. And but troponin T will be coming positive only after 2 to 3 hours only it started rising. Next, for a diagnostic test, it's a more invasive test. It is an angiogram. In that, you are entering through the skin, you are entering the artery and taking a catheter into the heart and injecting, finding out the coronary artery at the aorta base and injecting a dye into this coronary arteries itself and see what are the block. It's a complicated procedure. It has its own risk also that we have to should understand. And here again the dye is injected. So the kidney patient, if the GFR is low, you are under risk for renal failure. So, and also that X-ray radiation, because it is a cath lab, it is the X-ray also is used. So there is an X-ray exposure also is there for the angiogram test. And if it is usually nowadays, if the as a diagnostic procedure, as a primary angioplasty actually, many of the cardiac units are all doing, I think all over the world, they do a primary angioplasty. But that is check the put the catheter and check it and see it and put a stent inside. And even before this angioplasty and all is coming, this stent is coming, we used to give an injection to lyse the clot. If the clot is there, no? So you can give an injection which is able to lyse the clot. And if you are able to give it in within 1 or 2 hours of the onset of injection, it can lyse. That is less invasive actually. All the medicines and all the procedures has its own risk. When we talk about two type of management, we should know what is the plus and minus also. For this clot lysis treatment, that is only an injection is given and the clot is diluted, and then you can give some oral antiplatelet agents for some time. And then if you are able to correct your lifestyle, you will be able to withdraw the antiplatelet blood thinners and in a later stage. But if you are putting a stent, then the possibility of getting a clot on the stent itself, because stent is a foreign body, so that is there. So if you are putting a stent, you have to take at least 2 blood thinners like aspirin, clopidogrel, and even many cases there are 3 such medicines also given, and it has to be continued for at least for an year. That is the problem. But the other thing, if a patient is decide that once had an attack and the clot lysis treatment is, the medical treatment is done, then if he decides to correct his lifestyle, he can come out of the medication. But only if the patient is willing to correct the lifestyle and all the parameters like hypertension, blood sugar, and cholesterol are brought down without medication, then only he can stop all these things. But that is a possibility. If the patient is willing, that is possible. But if a patient is put on this stent and then he has to go on for that antiplatelet or blood thinners, or at least for 1 year. For many patients, even if angiogram is done, angioplasty may not be possible because of the certain location of the block, or the vessels itself is already so rigid and calcified. In such cases, the dilatation, the pliability of the blood vessel is lost. Then the doctor won't be able to put a stent inside that. In such patients, they usually ask directed for a bypass surgery. Next, what is bypass surgery? That is also when you go for an operation, you should know what is it actually. So in a bypass operation, what is happening? You have to open your chest bone actually, that is cut at the center, that is the sternum. It's a very strong bone, so it has to be cut with just like what is using for the cutting the marble and the cutting the tiles and all. No? So strong machinized thing is there. So it has to be cut open, and then the heart is exposed, the pericardium is exposed, that also cut open. Then you see the heart and the outside the heart. Actually, all the blood vessels are all the right, left, all is running over the heart. So then one blood vessel, actually that one of the internal thoracic artery, that is which is supplying the 2 arteries like that is there, supplying the chest. Usually these chest internal thoracic arteries are connected to the heart actually. That is one way of bypass actually. Another, if there are 4 bypass, 5 bypass and all is doing, that is only 2. So 2 can be done like that. Usually saphenous vein is taken from the leg and connect it with the aorta, that is a major blood vessel, and connect it to the coronary artery after the block. So, but if only a point of block only is there, this will be effective. But the whole artery is, or the major, after the major block part, it is whole blood vessel is damaged, then it will not be of much use also. No one is doing coronary angiogram immediately after bypass surgery and all, what is the saying, or even if you do the surgery, it may not be, the graft may not be fully successful also. So such complications, so many complications can come during a bypass surgery, because the heart lung, it is connected, the heart and lung oxygenation is connected to a heart lung machine. Your blood is given injections to not to clot, because it is running through a artificial environment. To not to clot, make it some medication like a heparin is given. So many complications, especially thrombogenesis and a small infarct and brain damage, because of these small blood clots, microclots can come and it can deposit in the brain, and so many complications can occur. So because these heart patients who require bypass will be having so many other diseases, and all the other organs also will be damaged. The heart alone will not get damaged. Usually other organs also will be damaged. So it is a major, especially we are seeing nowadays the surgical and anesthetic technology is increased, and we are seeing even 80 years, 90 years and all, even 70, after 70, 80 and all, bypass surgery is done. But we should know the impact also. And there can be even their own healing and all can be, because age increases and other comorbidities like diabetes, hypertension is increasing. The complications of the surgery will be more. Next, the medications which is given for the heart disease patients is for correcting the parameters like blood pressure, or reducing the blood pressure, or reducing the heartbeat number like beta blockers, calcium channel blockers, or all actually reducing the BP, so that the heart has to function less, workload is reduced. Next is for the cholesterol, to reduce the triglyceride, cholesterol. If the patient is diabetic, give the diabetic medicines. Next is blood thinners. That too, if there is another clotting, to prevent the blood clotting, that is actually aspirin and clopidogrel and all these medicines are actually blocking the platelet. That is the one which is helping us to actually the clotting mechanism is a part of the immune system. If you get a wound internally or externally, the blood oozing should be stopped and patched off. The blood vessels should be sealed to prevent further bleeding. If you are taking an aspirin or the blood thinners, the main risk is most of these heart patients are hypertensive also. So what is the major risk of hypertension is to get a bleed inside the brain. If the hypertensive patient gets some, because of the pressure, if a blood vessel is opened up in the brain, then if you are on blood thinners, the chance of the patch work will not happen. The sealing of the damage will not happen, and the blood will continuously ooze out, and hemorrhagic stroke can occur. And another complication with all this, especially after you put a stent, you cannot withdraw this aspirin and clopidogrel, and you are on 2 or 3 such medicines. In such condition, if you meet an accident, or you need another operation immediately, so it will increase the bleeding actually. Bleeding, even this aspirin and all, the action will be there for 1 week at least, because it is blocking the platelet action itself. So it lasts for the lifelong of that platelet. So if you can undergo an operation or anything, you have to stop at least for a week. For elective operation, it is okay, you can stop. But if immediately after you are stopping the medicine, the risk of getting a thrombus and getting a stroke or an attack is there. If you don't stop, the risk of bleeding is there through the injury, or also if you go for any surgery. But that is the risk factor actually. Next is, we have discussed all about the problems of why this heart attack comes, and also what are the treatments and the complications of the treatment. And when we hear really about the treatment, complications of the treatment, you will be really, that is the norm actually. There is every medicine or every surgery has its own risk also. For almost all the surgeries, or especially those who are doing under anesthesia, like this cardiac interventions and all, is having real risk is there, even for the death also. And we are very commonly taken the aspirin and all, also having complications, especially if you get the chance of internal bleeding, even the intestinal bleeding. Then what is the solution actually? The disease is there. There are so many complications with even the medicine and the surgery and everything. Then what is the solution? Then we have to go into what is the root cause of the disease. The root cause of the disease, it comes under lifestyle disease. It is many added lifestyle diseases, one after another, only comes to bring you to cardiac angina or heart attack and all. So the basic thing is, it is lifestyle disease, and you have to correct the lifestyle. If you are obese, bring down the weight. If you are diabetic, control your carbohydrate, and make your sugar normal. If you are hypertensive, again you have to adjust. Hypertension is a lifestyle disease. We can control the lifestyle hypertension with the diet alone. So control the diabetes, control the hypertension, correct the cholesterol without medicines. That is that. To do these diseases are because of the lifestyle. So your real solution is only by correcting your lifestyle. For the lifestyle, what are the three aspects is there for any disease actually for the lifestyle? One is the food, excess calorie and lack of nutrient. That is the major, essential nutrient. That is the major according to the diet. So we are actually using or taking all the food as a taste only we consider. We are not considering the nutrition aspect. Then so many color and preservatives and all are coming inside. And the sodium potassium ratio is imbalanced. And sodium potassium ratio, actually sodium and potassium is the major elements which is controlling our blood pressure and nerves activity. That is actually the sodium potassium, because of the newer this modern diet, it is actually reversed. It should be ideally sodium potassium ratio should be 1:3 or 1:4, but it is reversed in the opposite way. So our food containing so much of sodium and low potassium, because the processed nature it will remove the potassium and sodium is safe. And omega-3-6 balance. Omega-3 and 6 is controlling your immunity and immune system and hormone system. The omega-3 is so low, that is the healing power, and omega-6, the inflammation and defense is very high. So this omega-3-6 balance, all these lifestyle diseases are inflammatory in nature. Then the lack of exercise. Our three factors: one, nutritional imbalance; two is excess toxin in our food; and three is lack of exercise. All these lifestyle diseases can be corrected with a single solution, that is the lifestyle correction. When you come into a practical diet, especially in this modern sedentary life, what we can eat? Actually, we are all eating cereals mainly, or potatoes. Western countries and all, potato chips is the one of our potato preparations. So the starch is the main item. Actually, starch is main, and it is all nowadays. The oil is so cheap and so plentifully available, and it is more tasty when it is fried. And more oil, more tasty. More sugar, more tasty. More sodium, more tasty. So we are adding all these unnecessary things into it. So if you change your lifestyle to a low calorie, especially if you are overweight, low calorie diet, focus on leafy vegetables and pulses, and if you are taking non-vegetarian diet, moderate non-veg food also, and cut on this high calorie cereals and roots and all, and sugar also. So then you will be able to control all these parameters, body parameters. But already you are taking your many medicines, you won't be able to control by yourself. Then you may need a clinically supported lifestyle correction. In brief, one, the first step to prevent or reverse lifestyle disease like heart disease, hypertension, diabetes, etc., is to find out what is the ideal weight as per height, physical activity, and genetics, and try to achieve it. 2. Check whether there is excess stored fat in the body. Easiest way to check for excess stored fat is to self-evaluation in front of a mirror and check for protruding tummy and fat folds at sides and back. Try to regain optimal body shape, especially waist circumference, and maintain it. 3. Next, check blood pressure, diabetic markers like insulin, HbA1c, blood glucose, cardiac markers like lipid profile, hsCRP, inflammatory markers like CBC, complete blood count, ESR, CRP, etc., and make sure they are normal. 4. If BP or blood parameters are rising above normal, take medical advice on correcting it by lifestyle modulation rather than starting medication. 5. Remember, the body considers all drugs or medications as toxins. Restrict medicine use for emergency situation. Try to avoid taking medicines regularly like food for lifestyle diseases every day, lifelong. Instead, try to correct lifestyle, reverse disease and taper off medication under medical supervision. 6. Remember, your body is basically a chemical factory containing around 50 trillion cells. That means 50 trillion small units. And you are the manager. It is your responsibility to ensure optimal nutrition, rest, sleep, and physical and mental activity for your body, and also protect it from toxins entering it through food, water, air, medication, and cosmetics. 7. Remember, there is no medicine without side effect, or no surgical procedures or medical interventions without possible complications, especially for those suffering from chronic lifestyle diseases. Therefore, try to avoid over expectations on medication and on medical and surgical interventions. 8. Remember, diagnostic procedures like angiogram, CT or MR angiogram, angioplasty, etc., where injection of dye is necessary, can harm your kidney. If you are willing for lifestyle correction, blood test and ultrasound scan with almost no side effects are generally sufficient for progress assessment. This is more important for those who have below optimal kidney function. 9. Remember, the basic reason for hypertension, diabetes, dyslipidemia, atherosclerosis, heart attack, etc. are not the lack of medication or surgery. Instead, all these diseases comes under lifestyle diseases. Therefore, the optimal solution is to optimize lifestyle, which will help you not just to control symptoms, but to reverse simultaneously the disease process for multiple diseases. 10. Latest reports show angioplasty and bypass do not reduce the possibility of another heart attack, nor reduce the risk of death due to repeat heart attack. Therefore, before adopting such major procedures or surgical interventions, consider the associated risk, benefit, etc., and the option of lifestyle modulation too. Heart attack, hypertension, diabetes, obesity, numbers are increasing. Equally so, angiogram, angioplasty, bypass operations, and related surgeries are also growing. Before any invasive intervention or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present and correct the lifestyle to reverse them. Also, it can be understood why medications and surgery can't reverse such diseases conditions. It is not the lack of medication or surgery that creates the disease in the first place. This is why it is essential to understand how unsuitable lifestyle changes can only reverse these diseases and more importantly, prevent their recurrence. Before any invasive intervention or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook gets many to be opportunistic and take advantage of the surgical options available primarily on the financial viability angle rather than on an overall picture. This is where the statistics that often provides as the huge percentage of unnecessary surgeries done on unknowing patients deserve maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of the undesired consequences or even death from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle disease, and if the advantage of reversing them with lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer. And this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecarecentre, Thevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition along with the Oxyflex is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc., and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity, and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next, we'll go through few patients' experiences about this clinically supported lifestyle correction, how it is beneficial for a cardiac patient actually. This is a male patient, 49 years, 170 centimeters height, weight 71 kg. And he was a non-diabetic patient for the last 10 years. And he got a chest pain and admitted in a hospital. And they had undergone an angioplasty. And one stent was put. And after a few days, he was taken again an echocardiograph. They were not able to put all the stents. Actually, he had 2 or 3 blocks were there. They were only able to put one stent. And there was difficulty in stenting. So they decided to for a phased stenting actually. After 1 month again to do the one or two more stent has to be put. And on the 4th day of after the procedure, they had done an echocardiogram and they saw a clot inside the heart also. So they were waiting and he was put on a heavy blood thinners actually. That is aspirin, clopidogrel and apixaban was given. And also Evabrand, Febadone, Aldactone, Telma, Prolomet. It's all for BP and for the heart, and also Stor was for and diabetic medicines also. 3 diabetic medicines, metformin, dapagliflozin, and dapagliflozin, and also an anti-acidity medicine also. So altogether there is almost 15 tablets he is taking every day. And he was he came very tired. That was his major, he was telling, and his BP was only 110/60 and all. So because he's on heavy anti-hypertensive medicines and all. And with the clinically supported lifestyle correction, we check first this whether it is type 2 diabetes and his insulin reserve or the pancreatic reserve. And his insulin level is actually high, 52. See, high insulin level itself is a reason for the hypertension. So before, and with all these medicines, his HbA1c is 8.8 and his renal function had come down to 70. Because of this angiogram and all is also done. No? And along with that, he is having a prostate, when the testing is done, he is having fatty liver is there and also BPH, and his PSA is high also. It was 6.1. So it is alarming that it can be early stage of prostate cancer also. So he was started with lifestyle correction and special low calorie food and the special exercise called oxyflex. And this can be done these exercises are done for the cardiac patient or even arthritis patient, and all can be done on a lying down position on the sleeping bed itself actually. And it's lying and sitting down position only. There's no hectic exercise or anything. And with that, actually, after starting, all the diabetic medicines were stopped in the first day. So he has actually, because his BP is normal and his even troponin level was normal at the time. So he was been withdrawn from the medications. We were able to withdraw the medicines. And when the 8th day, when he came for his medicine number was reduced to 6 actually. And without a diabetic medicine, with the diabetic medicine, his HbA1c were 8.8, but down to 8.1. And BP was again maintaining normal. On the 8th day, when he came, his 180 only. The the BP medicine is reduced. Actually, in the 15th day, again reduced, and on the 30th day, he's only 3 medicines, that is 4 tablets, that is for this blood thinness. Because he's already had the clot and the other things are there. He was asked to continue the blood thinners and get the advice of the cardiologist before you reduce on medication actually. But all the other medicine for the hypertension, heart and cholesterol, and all stopped within 30 days, which is all over. The only other 3 anticoagulants, that is because he is put on a stent. Otherwise, there is a risk of clot formation on the stent. That is the reason. And even his PSA level has come down to, that is a usual finding. Whenever we usually check for especially maybe middle-aged people and all, because the cancer is so common. We do a panel profile of test for the early detection of cancer also. There are many people with the PSA positive, like CA120 for the ladies, for CA120 positive, or CEA, that is a marker for the colon cancer. Those positivity was many patients it can happen, see, but it will come down within a month or 2 usually with this regime. And if the tumor markers are very high, then they will be putting them on a no carb diet, that is almost reduce the glucose or the carbohydrate content to 50 gram per day. Otherwise, there is only if the sugar is there, there is not that much strict. If the cancer patients, more carbohydrate-free diet is needed. Otherwise, you can, if the diabetic patient, they can even, when the sugar is controlled, they can have a sweets also for once in a while. There is no harm in taking mild amount of sweets or fruits and all. It's possible. When we summarize this patient's history, he is not only able to avoid the cardiac intervention or the stenting, but he is able to get rid of the hypertension, diabetic medicine, hypertensive medicine, cholesterol medicine, and he is free of medicine also within 3 months for all those things. Only to keep your stent not making clot, he is taking the blood thinners. That he has to continue for a month or for a year. We'll go through one more patient's story. And she's a 79-year-old lady, height of 155 centimeters, weight 63 kg. And she was diagnosed, she's on diabetes and diabetic medication and insulin for the last 10 years, hypertension. And when she has gone with the chest pain, they have diagnosed kidney failure also. Failure stage 4, and her GFR was only 23. So she cannot undergo, especially because of her age and the low kidney function. Even though she needs a angiogram or stent or bypass surgery, she cannot undergo that. So that is the reason for she came here. She's actually having severe angina, and she's not able to take a bath of her own. And in between, even unstable angina sort of situation she was when she came to. Because even without exercise, she gets some pain. So, and also he is having a thyroid problem, liver, fatty liver, and hearing also was reduced. And after her also diabetic pancreatic reserve is very good, and she was on insulin, and her insulin level was 127, so high. And C-peptide is normal, that means C-peptide is also is very high, so 8.9 actually. So she's type 2 diabetes we have started on, and with the result, she was, when we are starting, she has 12 medicines are there, almost 16 tablets she was taking. And the 8th day, when she comes, she was only taking 7 medicines. And the 15th day, only 5 medicines. And 30th day, all the medicines are over. Because she was not put on a stent. That is why the all medicines are over. When she came on 15th day, there was 1 tablet was there, and it was tapered off within a week or so. So when she came for the 60th day, there's no medicine. Her HbA1c was, with the medicine, it was 7.6 and came down to 6.1 in 60 days. And on the 90th day, it was 5.8. And moreover, and also her BP is going fine, cholesterol is okay, keeping normal, and triglycerides is normal, and even her renal function improved from 23 to 42 in 60 days. So usually we monitor the patient up to 180 days is the parameter, and if the renal function is not improved properly, then we may continue with some more support for the nutrition support for the kidney too. Usually it will at least, what is our aim is at least to bring her GFR level above 60, then she will be safe for her lifetime, because she is 79 years. So what is her advantage? For when I summarize, she is actually, she got out of all the medications for the hypertension, diabetes. She was suffering from diabetes for a long time, hypertension, everything is over, and also her renal failure also is getting reversed. I'll quickly glance to one more patient. This lady is a lady, and she's 55 years. She was not diabetic or hypertensive or anything, and she was diagnosed with the heart disease in 2021, and an angioplasty was done. One stent was put. But in 2023 May, she had got another attack, and a bypass surgery was done. But after the bypass surgery, that is was done in May 23, and October again she had an attack, and angioplasty with 2 stent was done. And again in November, she got another attack, and she was undergone a balloon angioplasty. And there are 2 more blocks is there, she was asked to undergo a repeat bypass also. In such a situation, she is coming, and she was, when she came here, she was mildly pre-diabetes is there. Her HbA1c was slightly high, and she was on, even though she was not a hypertensive patient previously, she was taking 4 medications for hypertension, 3 cardiac medicine like GT and Robitrate, Coromandel, Tuiconandol, and 2 blood thinners and statin, rosuvastatin, 40 milligram, and now she is thyroid, Hashimoto thyroiditis also, or thyroxine also she is taking, and acidity, anti-acidity medicine. So altogether she was taking almost 17 tablets actually every day, and it was come down to 6 in the 8th day and 3 in 5th. By 30 days it is come down to 3, and that 3 tablets she has to continue for another year. That is her last putting stent was done in July 23. So she has to take the blood thinners for another 1 year. Otherwise, she is perfectly okay. And when she came, her body age, that is actually even the body age get. That is more almost all these patients with this diabetes, lifestyle diseases, the accelerated aging will be there. So she was only 55 years, but her body age was 65. And when she came to 90 days, her body age came down to 58. Actually, she was not fully cooperative, because in between she was, after all this problem is there, but she was in between, her children came from Canada or US. That is the situation in Kerala. Most of the parents, the children will be outside. They will be, when they come for visit, they won't be able to follow all these things. So there was, even though with that fully, she was not able to fully dedicate for the program, she was able to reduce her body age also almost 8 years down. And if you are, definitely she will be able to, if she follow the regime correctly, and ideally she should be below 50 kg, and she now last come she 54 kg, and she comes down to 49 or 48, she'll be able to bring down her body age to below what is 55. That is, she can bring down her body age to below 50. And even though her my calendar age is 55. So even there is a because the nutrition and physical exercise will reverse the aging process also. So when we summarize this patient, she was supposed to go for another second bypass also. But now she is not only escaped from the bypass, but she is able to come out of all the medicines, and except the 3 blood thinners, which also can be over by the next within 3-4 months. That is, by July she will be able to come out of those medicines also. Here, the focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patients can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from disease is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation comes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.